welcome to Dora the Talk Show, and I'm Nurse Wan Yi. I'm Nurse Wan Yi, and this episode we'll be talking about the management of T-tube. A T-tube is placed after a cholecystectomy procedure, and it's a treatment for symptomatic gallstones and other gallbladder conditions. Patients who suffer from cholelithiasis or cholecystitis will usually require T-tube insertion. From a research in the United States, though Asians has the lowest incidence of having gallstones, but 10 to 15% of adults suffer from gallstone diseases. And by the age of 60, almost 30% of all men and women have gallstones. Next, we are honored to have Dr. Zakir to elaborate more on cholelithiasis and the insertion of T-tube.
Thank you for inviting me to this Dora Health Talk Show. I am Dr. Zakir, a surgeon by training, now a lecturer in Alice Lee Center for Nursing Studies. There are so many interesting things to share. I am a very adventurous person. I can tell I am a great fisherman. I fish daily for that 2 years in Maldives, and most of the time I am very successful. What is that you want to know from me?
How are gallstones formed?
Yeah, to understand the formation of gallstones, first you should know the composition of bile. The bile contains about 97% of water. But cholesterol, bilirubin and bile salts are also important constituents of bile. So if the bile salt level falls, or if the cholesterol level increases in bile, then cholesterol will precipitate and form stones. There are certain conditions where if the person is having an increased breakdown of RBCs in him, then there will be increased production of bilirubin, and this increased level of bilirubin in bile can also result in the formation of pigment stones. And then some people may have combinations of pigment as well as cholesterol resulting in mixed stones. So stones forming in the gallbladder is called as cholelithiasis.
So how can this disease be treated?
The most common treatment option available for gallstones is cholecystectomy, especially in symptomatic patients, and that cholecystectomy is nowadays fully laparoscopic procedure.
Okay, what are some possible complications of the surgery?
Yeah, the most common complication that occurs following a laparoscopic cholecystectomy is wound infection. Sometimes you can get bleeding during the procedure, and then bile leaks are possible. So bile can leak into the peritoneal cavity and can result in peritonitis, and rarely if the bile duct was injured during the surgical procedure, then bile duct strictures can come. And finally there is one last complication which is called as post-cholecystectomy syndromes.
Okay, what is the role of T-tubes in cholecystectomy?
Yeah, we have said that gallstones usually form in the gallbladder, but sometimes you can get stones in the bile duct, the common bile duct. And you try to remove these stones by putting an incision in the common bile duct. You don't want to stitch those incisions because you are worried that following those incisions, when the wound heals, there will be some edema, and then this edema can result in a blockage of the bile duct, and this blockage can result in buildup of bile which can leak through the wound into the peritoneal cavity. So to avoid that, it has been a tradition to keep T-tubes into the common bile duct. So T-tubes are always used for stones that are being extracted from the common bile ducts.
Usually, how long are these T-tubes in place?
Yeah, it depends upon the indication for which T-tubes are placed. If it is just for the purpose of common bile duct stone surgeries, then usually it is kept for about a week's time. I too enjoyed these minutes of talking with you. It was a great experience, and thanks for making me so popular.
Thank you, Dr. Zakir. That was interesting. So next, we'll have our Dora nurse to visit our patient Amoy to check on her after her T-tube insertion. So let's go.
Hello, I'm staff nurse Dora. Today, we'll be visiting Madam Amoy. She just had a cholecystectomy done 3 days ago. I could just check on her and see how well she's doing. Let's go. How are you doing after the discharge?
Still okay lah, still a bit pain.
A bit pain. I see. From a scale of 0 to 10, 0 is no pain, 10 is the most pain. How will you rate the pain?
Around 2 lah.
Around 2. I think still okay lah. For pain relieving methods, right? I can teach you 3 ways.
Firstly, do sprinting. Press a pillow against your tummy area. Next, practice deep breathing.
You're doing very well. Good job.
Lastly, distraction. Do activities that diverts your attention.
Where's the caregiver?
Oh yeah, Maria, come.
Oh, yes ma'am, yes. I was sharing with her about some pain relieving techniques.
Okay.
Yeah. So can I just check when is the last dressing? When do you change the dressing?
Yesterday morning.
Yesterday, yeah. Okay. So today haven't changed yet?
Haven't.
Can you show me how you change your own dressing?
Okay, I go take my things. You wait
Do you
ah.
remember?
Can. Firstly, prepare your requisites. Before you start, remember to wash your hands for infection control. You can either use normal saline or cool boiled water as a cleaning solution. Next, wet the cotton balls and drain off the excess solution. Prepare a plastic bag to dispose of the waste. Wear your gloves, but if you do not have any at home, you can always use your bare hands. Next, remove your old dressing. You can wrap it in your glove and throw it away. Check for signs and symptoms of infection. This includes pain, redness, warmth, and swelling. If these signs are seen, it could mean that the wound is not healing well. It is important to seek your doctor's advice. Using one hand, pull the tube up gently. Using the other hand, swab the surrounding skin using a cotton ball with circular motions. Check the cotton ball for any discharges. After cleaning, let the skin dry with a piece of gauze. Use alcohol swabs to clean your scissors. To prepare a piece of gauze, cut it until the midline. Fit the gauze nicely over the tube and the wound. You may want to add more gauze if there's excessive as you did. Prepare tape to tape the 4 sides of the gauze. And there you have it, you're done!
Can you just check your own side?
Okay.
Just check the mittens here. Always remember to keep this below your waist level. It's to prevent the backflow of the bowel into your abdomen area. Yeah. It's to also prevent infection. Okay. That's a good job, well done. As you are resting at home, must remember not to carry heavy objects for up to 1 week.
Okay.
Yeah, because if you are carrying heavy objects, it might have strain on your wound site. You have to report to the doctor if you have fever for more than 2 days.
No fever.
No fever.
No.
That's very good. Okay.
Mama, you want to eat already?
Hungry ah.
I buy lunch already. Today you eat cereal, okay? Make for you one. Very nice. Is it not
Cereal again ah.
Yeah, brown rice, very good for you.
Aiya, don't want lah.
You'll like it lah.
Don't want lah.
Good for you, you just had your operation, you know. Then we eat rice, veggie, then later finish your gum ah.
You eat that one Maria?
Nice, very nice. My favorite, you know, curry.
I want that one.
Cannot, you just have your operation, too oily.
Cannot. All this high in fat and cholesterol, not good for you. It's not good. Very good. Mama, don't sad lah. Next time when you get better, you can eat more food like us. Okay?
Eat smaller and more frequent meals. This will help to ensure a better mix with the bile available. Include small amounts of lean protein such as poultry, fish, and non-fat dairy at every meal, along with vegetables, fruit, and whole grains. Go easy on fat. Avoid high-fat foods, fried and greasy foods, and also fatty sauces and gravies. Slowly increase the fiber in your diet over weeks. This can help to normalize bowel movements by reducing incidents of diarrhea or constipation. Also, some patients might find it difficult to digest caffeinated beverages and dairy products.
You see my lunch lah. I cannot eat my favorite curry chicken
Don't worry. Don't be sad. Actually, there's a reason why you can't eat all this oily food. Because your gallbladder is being removed. What happened? Amma, look precisely. Amma.
Aiyo, Bola. Just now eat already, want to sleep lah now.
Alamak. Amma, this one important. Cannot sleep. Listen, Amma, cannot sleep. Amma, your gallbladder is supposed to help you digest fats. Without this gallbladder, you cannot digest fat effectively. So if you eat a lot of oily food, you might end up with diarrhea.
My diarrhea.
Diarrhea is not good. At the same time, you have to drink a lot of water. Because of the drainage, right, you're draining out a lot and losing some fluids. It's important for you to hydrate yourself and drink more water. That's very good. By the way, do you have any problems with the tube?
A bit inconvenient.
Definitely you'll feel very inconvenient because you might not be used to having a tube suddenly. But no worries, this tube will just be temporary. Actually, once the drainage has decreased, right, it will help you take out the tube. By the way, do you know what you should do when you're showering?
I tie the bag inside a plastic bag.
How about the wound side?
Also cover the plastic bag
It's very important to keep the wound side clean and dry. It's also to prevent infection. By the way, do you smoke or drink alcohol?
Don't have.
Don't have, it's very good. You cannot smoke and drink alcohol because it actually can decrease the healing. Decrease wound healing.
No.
Okay. When you are changing the dressing side daily, right, you also have to remember to check the skin surrounding. Ensure that there are not there's no redness, swelling and stuff. If there's a severe vomiting, nausea, abdominal pain, you have to come to the hospital. Do you know what's the next appointment?
Maria, appointment card.
Okay, so you can see you have an appointment with Dr. Quack. You know Dr. Quack? The one who did the operation for you?
Correct.
Yeah, it's at the same place, at least Lee Hospital. Okay?
Hey, Miss, I got one more question. When can I go out to Jakia?
Actually you can do it now.
Now also can.
Before I go, do you want to go out and have a walk with me?
I want, sure.
Okay, let's go.
Simple exercises such as walking can improve blood circulation, promote healing, and prevent circulatory complications.
In summary, with proper handling techniques and care, managing a T-tube is not as hard as you think. So that's all with our T-tube episode, and hope you have enjoyed the house visit with Dora the Explorer. The Dora the Nurse, and hope to see you in the next episode.